I'm Dr. Adel SULIMAN. I'm a maxillofacial surgeon. I'm going to talk briefly about the facial bone fracture. We can divide the face into three parts. According to the craniofacial fracture, the fracture of the cranium and the face. We can divide it into upper third, middle third, and the lower third. The upper third is a fracture from the vertex to involve frontozygomatic suture bilateral with the front nasal bone, and the lower two from the same level of bilateral frontozygomatic and frontonasal involve all maxilla down to the alveolar bone, and the lower third is the mandible fracture. The mandible attached to the upper third through the temporomandibular joint, and the mandible itself can be fractured and subdivided into condyle fracture or intracapsular, extracapsular, or subcondylar fracture, and the ramus fracture, angle fracture, body, parasymphysial, and symphysial type fracture. And we can divide the facial bone fracture into dento-alveolar fracture. It is a fracture of one or two teeth or more, and alveolar bone fracture. And we can divide into left 1, left 2, and left 3. The left one is called the low level fracture. This is from the anterior nasal pressure and horizontally involves the canine fossa below zygomatic buttress and zygomatic maxillary suture, and fractures the lower third of the pterygoid lamina. And left 2, it's called pyramidal shape fracture because it's called look like pyramidal shape. Okay, extended from the latter part of the nose and the frontal process of maxilla down to the malar region and the down to pterygomaxillary suture region, and fracture the middle third of the pterygoid lamina. And this fracture called pyramidal type of fracture. And the left 3 fracture is fracture involve frontozygomatic suture bilateral and the frontonasal suture. It divides the cranium from the lower part of the face, so it's called craniofacial disjunction or high level fracture or suprazygomatic type of fracture. And also there is a fracture zygomatic bone or zygomatic complex fracture. Malar bone itself plus zygomatic arch. It's called zygomatic bone fracture or nasal bone fracture or naso-ethmoidal fracture, or subdivided into naso-ethmoido-orbital fracture or naso-ethmoido-orbitofrontal frontal fracture. And the frontal fracture itself, or parietal temporal, is a part of upper third and related to neurosurgeon. And also dento-alveolar fracture. Dento-alveolar fracture is a fracture of one or two teeth or more with the alveolar bone fracture. And there is orbital bone fracture itself. Orbital bone fracture can subdivide it into blow-in fracture or blow-out fracture. Blow-out fracture from the orbit may go down, or fracture occur from the orbit, go to the maxillary sinus. The content of the orbit go to the maxillary sinus, make it trapdoor appearance, and it affects the muscle itself, maybe lead to diplopia, or it may lead to enophthalmos. This part of craniofacial type of fracture. Thank you.